This is your student nurse, Tania. I will be performing the donning and doffing of personal protective equipment or PPE as part of our requirement for disaster nursing. PPE is the equipment worn to minimize exposure to hazards that cause serious workplace injuries and illnesses. These injuries and illnesses may result from contact with biological, chemical, radiological, physical, electrical, mechanical, or other workplace hazards. Let us start now with the assessment. First, know the current institutional protocols for donning and doffing of PPE. Second, select the right PPE based on infectious agent. An established protocol, combined with proper training, helps to facilitate compliance with PPE guidance. Third, ensure PPE that is to be worn is properly sized and fitted. We have to visually inspect the PPE ensemble to ensure that it is not ripped or torn, and all PPEs and supplies are available, and also the sizes are correct for the healthcare worker. Now, moving on to the planning. First, we need to remove all the jewelry and ensure that our fingernails are short and free of polish and that cuticles are in good condition. Bacteria and dead skin cells accumulate between jewelries, and short nails prevent puncturing of the gloves. Second, apply the cup, covering hair completely. This is to prevent the possible contamination of the sterile field by falling hair or dandruff. Then lastly, third, prepare the necessary equipment such as the N95 mask, the appropriate size medical grade gown, goggle, and clean gloves to facilitate time management and easy access to needed equipment. Now, let us proceed to the implementation. For the first part of the implementation, which is the donning of PPE, I will start first with hand washing.
Turn on water and adjust the flow to lukewarm temperature. Warm water removes less of the protective barrier of the skin than hot water. Then do hand washing.
Now that we are done with hand washing, let us now put on the gown by sliding on the both sleeves. Then make sure that we tie the straps at the back. Then, next is to don the respirator or the N95 mask. Hold it using the non-dominant hand with the outside part touching the palm. The metal nose piece should rest on fingertips. Then ensure that the top and the bottom straps are dangling below the hand and not tangled or twisted. Now take the N95 over, covering the nose, mouth, and chin. Then use the dominant hand to place the top strap over the head. Then the bottom strap just below the ear. Then we have to ensure that the straps are not tangled or overlapping. Now, to ensure that the seal of the N95 mask, bend the metal nose piece starting from the center, working outward on the sides. Then perform the seal test by placing both hands on the N95 mask. Take a sharp breath in and feeling and ensuring the N95 is sealing over the face during inhalation. And also we have to keep both hands on the N95 during exhalation. While breathing out, feel for air leaking around the nose piece and the respirator's parameter. Now, if air is leaking around the nose piece, then try to readjust the metal nose piece and recheck the seal. If there is still air leaks, then we have to scrap the respirator and use another that fits the size of the face and seals. Now, for the next step is to don the face shield or the goggles. Place it over the eye area of the face, making sure that the straps are secured, placed over the head just above the ears. Then it should fit snugly and comfortably. Then now I will do hand washing again. Now after hand washing, I will now don the clean gloves by pulling each glove over the wrist to cover the sleeves. So that ends the donning of personal protective equipment or PPE. Let us now proceed to the doffing of PPE. First, we need to remove the gloves, making sure that we do not touch the outside of the gloves using bare hands. Now start taking with the non-dominant hand to grab the cuff around the dominant gloved hand. Then use pinching motion to grab it. Peel the glove off, turning it inside out. Then wad the peeled glove to a ball. Then take the index finger of the ungloved hand and slide it carefully under the cuff. Then peel off the gloves by pushing the index finger forward. Now discard. To remove the gown, we must untie it first. Then grab the wrist cover of each sleeves until hands are inside the sleeves.
Shrug the shoulders on upward movement to allow the gown to slide down.
Now from the inside, with the assistance of the hands, roll the gown away from the body by turning it inside out. Form it into a ball. And discard. Now let us perform hand hygiene. Now after hand washing, remove the goggles by lifting the strap overhead away from the face. Dispose or clean the goggles as per institutional protocol. Then next is to remove the respirator or the N95 mask. First, grasp the bottom strap, lift over the head, then grasp the top strap and lift overhead. Then dispose as per institutional protocol. Remove the cap, dispose, and for the last step, perform hand hygiene again. Now that we are done with the nursing skill implementation of donning and doffing of PPE, let us now proceed with the evaluation. We have to document the procedure and note the nurse's response, including the integrity of the skin. So that ends the performance of donning and doffing of personal protective equipment or PPE. Again, this is your student nurse Tania. Until next time, thank you for watching. Bye!